Imagine a scenario where accessing life-saving medical treatments becomes a bureaucratic maze filled with hurdles that could delay or even deny care. This is the reality some fear as the Trump administration introduces a new Medicare pilot program requiring patients to obtain prior authorization for certain procedures, ironically resembling the very system Republicans once vehemently opposed under Obamacare. But here's where it gets controversial. Could this move inadvertently harm the same demographic it seeks to protect? Medicare, the federal health insurance program designed primarily for individuals aged 65 and older, and also covering younger people with disabilities, has long been celebrated for its straightforward approach to approving necessary medical services. Unlike private insurers, which often demand pre-approval for procedures, a process known as prior authorization, traditional Medicare plans have historically allowed seniors quicker access to surgeries and other interventions without excessive red tape. However, the newly proposed pilot aims to change that dynamic significantly. Set to launch in January across 6 states: New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. The initiative will task private companies with using artificial intelligence, AI tools, to determine whether specific procedures qualify for coverage. These include treatments like skin and tissue substitutes, electrical nerve stimulator implants, and knee arthroscopy for osteoarthritis. While the Centers for Medicare and Medicaid Services, CMS, insists that final decisions will rest with licensed clinicians rather than machines, critics aren't convinced. They argue that relying on AI-driven evaluations risks prioritizing cost-cutting over patient needs. The CMS defends the program by stating it targets fraud, waste, and abuse within the system. Yet, Democratic lawmakers are sounding alarms, accusing CMS Administrator Dr. Mehmet Oz of introducing unnecessary barriers into traditional Medicare that could ultimately worsen health outcomes. In an August 7th letter addressed to Oz, House Democrats pointed out an apparent contradiction. Just weeks earlier, Trump administration officials had publicly acknowledged the negative impact of prior authorization practices when pledging reforms within the private insurance sector. On June 23, 2025, the letter reads, Trump administration representatives praised commitments from the health insurance industry to reduce abuses related to prior authorization. Yet shortly thereafter, CMS unveiled a proposal expanding the use of this practice in a form of coverage that rarely employed it before. The lawmakers go on to suggest that replacing doctors' expertise with algorithms optimized for denying claims might prioritize profits over patient care. This debate echoes a contentious moment from over a decade ago during the Obama presidency. Back then, former Alaska Governor Sarah Palin sparked widespread outrage by labeling similar healthcare proposals as death panels. Her inflammatory remarks centered around provisions in the Affordable Care Act, commonly called Obamacare, that would have compensated physicians for counseling seniors about end-of-life care options. Palin falsely claimed these measures amounted to government bureaucrats deciding who deserved treatment based on their societal contributions. A narrative that fueled public hysteria despite being debunked as misinformation. Ultimately, those provisions were excluded from the final legislation. However, the term death panels left a lasting impression, symbolizing fears about government overreach in personal healthcare decisions. Fast forward to today, and we see parallels emerging between past controversies and current policy shifts. Are history's lessons being ignored, or is there merit to incorporating elements of prior authorization into Medicare? And this is the part most people miss. What happens when efforts to streamline costs collide with the ethical obligation to ensure timely, equitable access to care? As discussions around this pilot continue, one can't help but wonder how it will affect everyday Americans. Will it genuinely curb wasteful spending? Or will it create more obstacles for vulnerable populations? Do you think the benefits outweigh the potential risks? Share your thoughts below. We'd love to hear your perspective.